Okay, I think we're live. So welcome everyone to another edition of the Perception and Action Journal Club. Today we have a really interesting paper to talk about. It was a Target article from 1996 in Behavioral and Brain Sciences by Latache and Anson, and as the title shows there, it's What Are Normal Movements in Atypical Populations. And I think it's a really interesting article. I think that has multiple implications, not just for rehab or atypical populations, as we'll see. Also, I think at the end we want to talk a little bit about why we don't have more interactions like this article. It's a really interesting format where you have a Target article and a bunch of commentaries. I think it's a really useful way to do it, but we'll get to that later. So I have two people that you've been on the podcast before in one way or another. I'll let them introduce themselves. In the middle, we have right next to me, Rajiv. Can you introduce
yourself? Hi, I'm Rajiv Ranganathan. I'm an assistant professor in kinesiology and mechanical engineering at Michigan State. My interest is in understanding motor learning with applications to rehab.
Cool. And you interviewed on the podcast, I don't know what number, but a while,
while ago, so thank you for that.
And then we have someone that's been on these journal clubs a couple of times before. Next to him, Harjiv. Can you introduce yourself?
Yeah, hey, so my name is Harjiv. I'm currently a PhD student here at the University of Nevada, Las Vegas. My primary interest is the sort of characteristics of instruction and feedback that optimize motor performance and learning.
Mm-hmm. Cool. Yeah, and so let's dive right in, and I think it's pretty evident from the title and what the central thesis of this article is, but. So one of them actually I thought was a good summary in one of the commentaries by Rich Masters. I'll read it. The central theme of Latache and Anson's Target article seems to be that atypical motor patterns in impaired populations should not be seen as abnormal, but rather as reflections of the remarkable flexibility allowed by the central nervous system and the redundancies present in the human body. In situations where movement system has been disturbed or impaired, however, this self-rule is often subjugated by the therapist who attempts to renegotiate new motor patterns in the body. So there's this idea that, we're maybe that the motor patterns that are a result of this are not abnormal, and maybe we're treating them the wrong way. So I thought I'd start with they do an interesting start of defining what do we mean by normal. A normal movement pattern. So kind of what did you guys take from that? He goes into some different ways to define normal. Do you kind of what did you take from that discussion?
Well, one thing that kind of struck me, and I think it's still true to a large degree. It's been almost 25 years since the paper. Mm-hmm. But when they talk about, they sort of review the literature. They're talking about single joint movements and multi-joint movements and so on. And before that, they say sort of, without a theory, the only thing we can do is to sort of talk about regularities, right? So what sort of things people generally tend to do. And it was just that sentence kind of struck me because I think it's still true. We still don't have other than sort of collect lots of data on certain tasks, we don't really have a good idea of defining this in any a priori way. So it's sort of that's one thing that struck me in terms of how do we define normal is we take a bunch and we take an average, and that's normal.
Yeah. No, I get the same thing. Rajiv, did you want to? Harjiv, sorry.
No, it's all good. So I think a really cool part about this paper was this idea of just adaptation in general. I think in context, adaptation comes with like this connotation of something being negative, just in general. And so it's funny because even when we think about it in terms of rehab and all that, we may think that things are adaptive in nature and whatnot, yet we still have sort of these tests that kind of have this general sort of motor pattern that you need to reach that we test these individuals for. But nonetheless, I think the paper did an excellent job in sort of telling us that, hey, adaptation is something that's good, and that it's not considered abnormal. And so I think just that general, it's just unfortunate that, 20 years later, we're still talking about sort of the same thing in terms of, adaptation may be bad still, when it's not. I think that's the general sort of takeaway for me. But in that one chart, that one diagram that you'll probably put up, but you put up on Twitter as well, that one was really interesting to see how he kind of laid that out. So.
Yeah, I mean, I could throw that one up. This, yeah, very provocative.
Yeah.
Yeah, I think there's a good point there. You know, I think in terms of the normal movements, I think they make a good point. This one here, right? We have everything, literally everything you can have on one figure. Michael Jordan, sumo wrestler, clumsy children, amputees. All right, it's pretty. But I think you're right. Like normal movements are. You're right in. They tend to, like, I think about it in sports. You know, we talk about what an expert does. And I think there's a really good commentary, maybe Masters commentary again, where they talk about that's really kind of a trendy thing that changes too over time. Like whether a two-handed backhand is the right thing to do changes over time. And then also, you know, I think it just gets passed up through history. Like, I think like if I had more time, I would love to trace back, you know, why we keep our head down when we golf, right? Where did that come from? It's just stuck in there now. Like you're not getting rid of it. But you're right. Does it have any biomechanical, you know, justification or things like that? But I think that's really interesting. Did this figure? Did you want to anything? I think it really is, like they admit it's meant to provoke your reaction and see, you know, things. One of the things I really wanted to get into in this paper is that I think that let me get rid of all my junk sharing screen. Is the issue of priorities, right? Yeah. One of the big things that he makes is they make in the article is that when you have an injury or an impairment, it changes your priorities in terms of solving a motor control problem. And I thought that was really interesting. I don't think that's something that we really think about very often in motor control, especially in sports. We always assume the only priority is achieving your goal, right? A performance priority. And we don't really talk about any of the other parts. Some areas of motor control do. And also I was interested, you know, what do you think where do priorities and constraints are they the same thing, or what are you guys' thoughts on this issue of priorities?
Well, I thought the whole priorities discussion sort of relates to this idea of, you know, a lot of the optimization approaches, right? They optimize some cost function, whether it's energy or effort or error or whatever, or some combination of all of these. So to me, that's sort of immediately, you know, it sort of brought me to that part of motor control. But you're right. I mean, it's other than laboratory tasks to define anything outside is just, you know, I haven't seen anything big other than that. So it's a very difficult problem to understand what the priorities of the nervous system are. And then if you now add this fact that, well, they may change not only in a sort of between individuals, but also in the sense of, well, if I now have a stroke or, you know, an amputation or something like that, it's just sort of again, it points to the difficulty of what we are dealing with. And to sort of go back to your point, it makes sense to some extent why we rely on, you know, say healthy controls as the model for rehab and experts as the models in sport, because we don't have a lot else to rely on in any way.
Yeah, no, I think that's right. What did you take from this? I was going to put up this other figure. We were talking about this before we went on air. Interestingly, in the paper they redraw the constraints triangle, right? Yeah. This figure, they put priorities as one corner and the task environment constraints, which are normally two corners all into one. Structure, I think, is still the body, right? But yeah, what did you take from kind of the emphasis on priorities, Rajiv?
You know, I originally, when I read this, I thought, you know, priorities and constraints, same thing. But as I got into the reading more, you know, it kind of just maybe constraints are the ones that sort of create these priorities. So like, you know, after injury or something, right? There's certain constraints as it comes to either the body or the environment that's created or whatnot, and then therefore that may shift priority of the central nervous system. So I thought about it both ways. I don't know which one is more plausible, but I think just thinking about it in two different lenses really sort of opened up a lot of different questions that I may have. But I do like the framework here where like he kind of goes down, or the diagram where like he goes down to control parameters. I've always been a fan of like control parameters and order parameters and all that. So it's really cool how that sort of flows. And I actually redrew this in my notebook with using the constraints led model. And then the same thing with control parameters and moving parameters. So, I mean, to me, it can go both ways, but I do think maybe constraints shape the priorities of the central nervous system. But that's just kind of thinking on top of my head. So,
yeah,
I don't know.
Yeah, I think sort of maybe to add to that, one thing they sort of get criticized a little bit for is to kind of, they adopt a dynamical systems sort of framework when they talk about nervous system does X and Y. And so to me, the priorities seemed like a way to sort of merge the two. You have the constraints that force some change in priorities, and then that sort of results in the movement pattern. So to me, the priorities are a intermediary if you're thinking about something doing the control.
Yeah, I had the same reaction. The priorities kind of kept bringing up very non-ecological, like it's almost like weighting, putting weights to things, which is not a dynamical systems idea. It's almost, there's also this idea that they really push throughout the paper that you almost have, I don't know what words to use for this, the top-down, I'll use this, top-down constraint of your goal you're trying to achieve, and almost these bottom-up ones of your body fighting against you, right, and not letting you do what you want to and in a lot of the examples he gives with atypical movements, they argue that part, that bottom-up or whatever you want to call it, is kind of overactive. It's like preventing people from getting injured and moving quickly and things.
Right.
Whereas in more normal people, we can fight through that. So I thought that was an interesting idea too.
Yeah.
But yeah, I think for me the constraint, the difference between the constraints. So constraints are almost always, we talk about them in task goal related terms. Like we don't really ever talk about efficiency or minimizing energy or avoiding injury when we talk about constraints, right? We always talk about, I don't know if they're in there. What do you think you can fit this concept within the constraints, you guys? Or is this idea of prioritizing these different sub goals? I don't know what you call them either.
Well, I do think you're right. I mean, priorities sound like the goal of the task, if we were to just kind of look at it that way. But using the constraints-led approach, it's maybe we have. Well, I wouldn't say that, but yeah, I probably think of it as maybe the priority is our goal, and then the constraints from the constraints-led approach, that model sort of gets us to that priority. But that's it. Like Rajiv said, I mean, they kind of mix together top down, bottom up, and it's kind of like they used sort of dynamical systems terms, but then used a lot of pre-programming in this paper. And so like it was kind of like, I don't know which way to go really, but I do understand where you're trying to come from. So
yeah. And to me, the sort of, again, the task goal itself, like we've been having this discussion on another paper, but this sort of idea of, well, people usually think of task goal in the sort of very short-term time scale, right? Okay, you're like, if I'm playing a tennis forehand, the task goal is to get it over the net. But then you can think about these goals in longer time scales, right? Of course, I wanted to get it over the net, but then, I want to maybe position the player in the opponent in a disadvantageous position, and then you can think about, well, then I want to implement this strategy, and then this sort of, like you say, injury prevention is a very, very long time scale thing. It doesn't sort of play a role at the level of a single forehand, but now if I have to practice a million of those, well, now that sort of fits in a much longer time scale. So I think the nesting of the task goals then brings about this idea that you can have priorities that are task goals essentially that you have set, but are not maybe reflected in a sort of very short snapshot of the task.
Yeah, I think that's an interesting way to think about it in the timescale. The closest thing I have that when I work with baseball players, sometimes sometimes a issue that I work with baseball batters is their follow through. So they follow through and they only use their arm or something, which is really a chance for injury if you don't follow through with your whole body. But the thing that I always try to sell them on is, your body's not going to let you accelerate as fast as possible if you don't have a plan for deceleration coming up, right? So it does. That's kind of what the feeling I closest as I can think of to where I get to this. Your body almost has these other priorities inherent in it that you have to satisfy, or it's not going to let you just do anything.
Right.
Yeah. So
and that sort of gets at their point, right? The sort of most provocative assumption they start with is like, we assume that we know more about motor control than the
yes, but I love that
they got some pushback in the end for that, but I think I sort of agree with them to a large extent on that. We know some things that the nervous system may not know in a very short time scale, but a lot of these things, like you said, if you don't have the movement pattern to slow down, or if you don't have the strategy to slow down, well, it's not gonna let you speed up. I think it's a great example of that.
On that sense, I keep thinking about like sporting examples, and I think they may have mentioned it a little bit, but like things like fatigue, for example, how does that shift priorities if it does, right? Or things like you're not playing well, or they mentioned under pressure, I think at one point. Oh no, that was a master's commentary where they talked about pressure. But is there like a way where you can, with under these specific environmental or task constraints, that all of a sudden your priorities will shift because of certain physiological sort of patterns, which is also because I talk about when I'm playing, when I'm really, really tired, there's things that I won't even do because I'm just really tired. So I don't know.
Yeah. No, I think that's a good point. And I think it also gets into a lot of like what an optimal, like you were talking about, what an optimal movement pattern is. And I think it adds a little extra layer to it. I think often, like the definition I use when someone asks me is the movement pattern that achieves the best performance given the individual constraints and task constraints, right? So it's different. And there's not one. But notice that's just focused on performance, right? It doesn't have these other priorities that they emphasize. So maybe we can get into. So if we think about, I know they started talking about things like Parkinson's disease, tremors and things. And you're right, they started getting some pre-programming ideas. But kind of, what did you take? Like, was there one kind of example that they gave of a particular condition or thing that thought was a good illustration of this idea? Did you guys?
Yeah, I thought the whole idea of bradykinesia, right? So moving slower than normal and sort of treating that as an adaptation to some, so say, deficits in pre-programming. I thought that was a really neat idea, and I think some people in the commentaries push back on that, saying this is not simply an adaptation. But I remember a paper maybe 10 years ago or something like that, where they were looking at speed accuracy trade-offs in Parkinson's and show that it's not really a movement issue. It's sort of like a reward type of issue. They don't. Yeah. If you push them, they can move fast. Push them meaning sort of metaphorically, not physically. But it sort of reflected the idea that it's not necessarily moving slow that's the problem. It's actually a reflection of something else that's going on, and that's why they're moving slower. I was surprised. I didn't know. Like, again, when you read papers again, you have some new knowledge that you're referring to. So I sort of immediately was struck by the comparison to that paper that came out a few years ago that showed exactly that.
Yeah. And there was a part in there that triggered. I thought you would like, Rajiv, especially because they get at the point of understanding instructions, right? In words like what does it mean to move as fast as possible? right? I thought that was interesting. Did you get
Yeah,
that part?
I wrote a whole page on that. So pretty much, I loved how they brought it up, because even in Parkinson's disease, actually, there's quite a few papers on the usage of action verbs and how action verbs actually help people with Parkinson's disease because of their low levels of dopamine, I think it is. So it's this idea of using specific words that can help. And I think there was one paper that actually showed this, that their movement time was quicker with, again, I don't remember the sort of task, but with the usage of action verbs, they were quicker. But now, at the same time, I think the instructions that they talked about, I think they did a really, really good job in sort of delineating, like, get to the target as fast as possible versus initiating the movement as quickly as possible, and how that kind of shapes the movement solution or the way you actually go about it. And so I think they had mentioned something along the lines of distal to proximal and proximal to distal. That was really interesting, because I don't think a lot of studies have looked into that per se. I mean, there's been a lot of attention, or a couple papers in attention, that have looked at sort of kinematics and all that, but not more than that. And we've just kind of stopped there. So I think that was interesting. And at the same time, to the point made earlier, while I haven't worked with any of these populations, I spent some time with spinal cord injury and cerebral palsy, and kind of just working in those populations. It's really fascinating how just the rules, like I said, the constraints, so like the rules, the environment, and all that, really shape how motor behavior is sort of done. So, for example, cerebral palsy, we use constraint-based therapy, which is pretty normal. Pretty popular. And just by restricting their non-affected hand, they were still able to do certain movements. There may have been a difference in how we cued things here and there, and I think that plays a huge role. But to the point of this just general, if you talk about atypical populations, the idea of adaptation and environment, and I always say, and I made this comment in Sean's conference earlier, and I said, there's a possibility that language actually structures space and how we actually go about our environment. And that's, if you go down into the rabbit hole of more cognitive psychology work, you'll see the work of prepositions and all that, and how that affects, just how we view our environment around us. So I think when they hit on that, I got really happy, because that was really interesting, and we don't really pay attention to that. And so,
no,
one other thing that sort of struck me is how you may give the same instruction, but different individuals sort of perceive the environment differently. Right? They were talking about some populations being afraid of breaking the equipment when they're in the experiment, and it just sort of again points out I've been a participant in a few experiments, and clearly there's differences between in one case the wires are all going everywhere, and you're even scared to put a finger anywhere, and then there's others which are really neat and clean, and then you don't have to worry about anything. But it's sort of we treat those as nuisance variables, right? We don't really think that can affect anything. But if what Latesh and Anson say here is true, which I think is true at least partly, these have a huge influence on what kind of results you get from different labs, right? I mean, how the environment is structured, how the particular whether you have weight support, whether you don't have weight support. I mean, all these variations can create a huge problem in trying to identify even what the problem is if laboratories differ in how they implement this.
Yeah, no, I totally agree. And I always say that I learned coming from a visual perception background. We in our lab, we had I call it a healthy distrust of verbal instructions, because we didn't trust, when I say judge the distance of that thing on the screen, I didn't trust that you would do that. Like
Yeah.
I designed the experiment so that if you weren't doing that, I would know. If you were judging the size of it instead, it would show up in the pattern results. Because you're right, people can interpret things in so many different ways, and it's so yeah, I thought that was a really interesting point. So I think their overall point they're making is maybe we're using the wrong standard of what a good movement is in that, right? We're assuming it's this that they're treating this as the main priority in the instruction when maybe they're not. So it's not really it's a goal difference, not a motor issue. Yeah.
And it sort of goes back to the like the dynamical idea of you don't want to treat the system as a blank slate, right? But in experiments we do, because we say, well, this is the only thing that's varying, everything else is the same. And especially if you're comparing different populations, that blank slate thing could be horribly wrong in terms of making that assumption. I remember there was this discussion a few years ago, I can't remember who said it, but this idea of take the simplest task in the laboratory, which is to match make a constant force, right? Now you do it with young adults, you do it with older adults show greater variability. Well, that's sort of almost universal. But then you think about, well, is it because they're really more variable, or is it because for them a little bigger error, they're fine with it, right? I mean, they don't have to there's no reason why they should have the same sort of error tolerance as the younger adults. And so if you sort of bring that in, well, that could change the whole picture of whether they're actually more variable or whether they're just comfortable sort of like, this error is good enough kind of mentality. So it sort of raises a lot of corny.
Yeah, I think that those are great points, and goals and incentives, and I had a similar, like in a lot of the pressure studies I did. One of the things we found was with expert, we tried to make people fail under pressure, and when you just add competitive pressure to experts, they get better. Because they were bored with my study before. They didn't care. Like, you're making me put on this little mat. I don't care how well I do. Oh, you add money now. Right? So we actually, social pressure was way more effective. But I think you're right. Sometimes we take for granted these, and I think that idea of priorities really captures it. But yeah, I think so. I think that's a good example. The other one they seem to get at again is this one I mentioned, where I think they describe like a movement as a perturbation of the system, that your body, there's almost this homeostasis mechanism that it's going to try to correct, like this compensation. And I think maybe tremors was an example of, they thought that was kind of overcompensation, right? It's trying to, you're moving and it's trying to correct and keep you stable. Or, I counteract. Did you guys get did you get that kind of same idea in reading it? Yeah.
And I think maybe related to that was the idea of, again, if you sort of, since things happen in time, where the constraint occurs may not really be where you see the difference. And so they give this analogy of like a downhill skier, right? There's one part of the trajectory that's sort of very difficult, but people will change both the trajectory uphill to that and downhill to that. And so that sort of analogy, and I think the example they gave was in the Parkinson's, maybe they're talking about, if I had difficulties in slowing down, then I would start off slow. I wouldn't like speed up and then make lots of errors. I would start off slow. You might think my deficit is in preparation, but it's really because it's driven by this constraint that's going to come up later, which is I can't stop as well.
Yeah. No.
Yeah. Agreed. No, sorry. Yeah, I agree. Yeah.
No, I think that's a great point. I was going to raise that too, that, localizing, that's another issue, localizing the exact deficit, in the nonlinear, if we really believe it's a nonlinear complex system, is really, it's really difficult, and it's a huge assumption you're making that the deficit, where the deficit occurs, where the effect's going to be is, is a really kind of flawed assumption, right? I used to always talk about this in class when we talked about lesion studies. My example I gave is if you took a radio or any kind of electronics and opened it up and smashed a part of it, and it started buzzing, was the job of that part to prevent buzzing in the first place, right? It's a nonlinear effect you've caused by damaging one part of the system. So yeah, I think that's a really good point this paper makes as well. Yeah, and the other one I thought was kind of interesting was the Down syndrome case. I thought that was a bit different. They are almost trying to talk about the cognitive mental deficits and put it in with the motor deficits. So did you guys get the kind of same? What do you think about that? Rajiv, did you?
I think it brought up a good point, because when we work with these atypical populations, they do have these mental deficits that obviously the normal populations don't. And so I liked how they brought that up, and how, that there is sort of a framework in which both of them are. It's just hard to study, I think, at the end of the day, right? That's one thing, is like, they have a mental deficit, but then you're also trying to optimize their motor sort of patterns. How do you go about that, and what do you compare that to? And so I think at the end they actually made a suggestion for a study. I don't know if that was in Down syndrome or not, but I mean, otherwise I do. What I would say is that, this idea of when you work with atypical populations, this mental deficit. I was kind of. I kept thinking about how I would design a project, and I was kind of trouble thinking about that. But I think there's a brain and behavior connection, right? We talk about it all the time, so that needs to be somehow figured out and stuff like that. But I liked what they did, that's for sure. Bringing those two together. So.
I thought. I mean, that whole discussion. To me, it felt like we can't really study these things as one-shot studies, or it's like, oh, in this condition, A differs from B is not going to be terribly informative, unless really, or to sort of go to their language. If you want to really understand the priorities of the nervous system, whether it be typical or atypical, you really have to kind of sort of scan the whole landscape, and only then could you even have some idea of what really the potential deficit is. And sort of, again, the results are the results, that is fine. But I think what these sort of issues seem to point out is, well, what do these results really mean? Is really difficult if you just have a very sort of small snapshot of what they can do. And not know whether it's because whatever, they're afraid of breaking the equipment or other things, and of course nobody probes for that level of robustness in terms of the results.
Yeah, no, I think those are one of the interesting parts of this to me was this was another area where they seem to be mishmashing different theories, like more information processing diameter. And for me, I don't know if you read it the same way, but I thought they were arguing that one of the reasons Down syndrome people tend to move more slowly, is they can't use information to correct their movements. They because of the processing deficit, they're not going to. Once I start moving, I'm not going to be able to correct it like a normal person can. So I'm not going to move as quickly. I'm going to be more conservative in my movement and things like that. To me, I don't know how that's kind of like, because normally we don't think about online control and regulation as being a thing that requires a lot of mental capacity or cognitive, right? So I thought that was an interesting got me thinking a lot. I didn't know if quite the explanation worked for me. I don't know if you guys did you get read it the same way? Yeah.
I mean, I think the theoretical framework at some point, I think, like in the reply to the commentaries, they say, yes, we sort of mix languages here, but they sort of make the statement that sort of at our current state of knowledge, it's not clear to us that it makes a difference whether we state it in theory X or theory Y. And I thought that was a fair point, in the sense of, yes, we have people who are sort of strictly on one theory, but I think the overall point is how you actually describe it, whether in terms of perception action or whether in terms of information processing. I think the fundamental point they're trying to basically get at is, if I'm going to make more errors at the end for fast movements, then the optimal strategy is to slow down right from the start. Yeah, that's how I kind of viewed it. But yeah, you're right in that's a mismatch in terms of.
Yeah, Harjeev, did you?
No, I agree, and I agree with your previous point about like the shift in priorities when you have like this sort of mental deficit. I just keep thinking in terms of practical, like, you know, if you're a teacher or a rehab professional working with these individuals, you know, if you have a shift in, if you do know that they come with mental sort of deficits, how would you go about, you know, basically, you know, like doing that and worrying about that, as well as the goal of maybe, you know, making them slow quicker or whatever in terms of their reaching times and stuff like that. I just kept thinking about how, if I was a clinician, how would I do that and I know they come with these mental deficits, you know, it's, I couldn't think of anything. So I just, you know, it was actually really interesting to me because we don't, as mentioned, we made, I think, these priorities shift for the individual, but at the same time, as well as for the coach or the rehab professional, has to understand that these priorities do shift and it's not the same priority for every single person that they get. I guess that's a better way to put it. But yeah, I just kept thinking about how would I do it, and I just didn't think of anything. So
yeah, maybe we can turn to that. I think that's one of the really interesting things of this paper, right? They're making the point not only that these, you know, these may not be, they may be adaptable responses, but that then, like I said, the courts, we tend to subjugate them by trying to change them. Like I think the example I like they gave was, you know, if you have a Down syndrome child that runs with a really short stride length, of putting markers on the ground to make them have a normal stride length. Like, so you really, and we do this in therapy, we instruct to form instead of functions, right? We're trying to get back the form we're looking for, the movement we're looking for, assuming that's the best way to get to functions, but maybe not anymore. I think that's their point in this new situation the person has. So what are your thoughts? You know, you do, you know, some research on rehab and things, Rajiv. What is this kind of you think makes you think about when you're talking about, you know, what do we do here? You're right, Harj is right. It's such a difficult problem. Yeah. But what are your thoughts on that?
I thought a lot of the commentaries sort of got to a sort of convergent point. I think those were mainly from, you know, the therapists sort of pushback on this idea is I think most of them said, well, you're kind of creating a straw man here in the sense that we're not necessarily trying to make movement patterns go back to normal, but rather we're trying to restore function. And so they sort of push back at this idea that, yes, some of these things may be adaptations, but if these adaptations interfere in some way with your function, then it doesn't matter if it's the primary source or the adaptation, you know, we need to fix it in some way. So I think the Konzak and Tishkan's commentary had something like, you know, like let's say it's stooped posture. That's, you know, maybe it's an adaptation, maybe it's a primary deficit, but, you know, that's going to affect your ability to interact in a social context. And so, you know, this to me is one of those things that makes rehab somewhat different from the sporting context, is because in the rehab context, you're not only trying to optimize function, but also these other constraints or priorities, whichever you want to call it, of, well, I don't want to walk in a way that, you know, or may not walk in a way that people start looking at me when I walk in a room, right? So it might be that I'm willing to say walk a little bit slower as long as I'm symmetric, you know, something like that, because then, you know, I'm less likely to be noticed. So I think that was an important point that came out in the commentaries, which I thought is really interesting because, you know, again, especially in the rehab context, it's not simply performance that matters. And I think, you know, even in the sort of common sense observation of, you look at, say, how pitchers throw, well, there are, you know, people who throw a submarine or whatever, and everybody's fine because, you know, they know they're just doing it on the field. But when you now say apply it to locomotion or reaching, and then somebody has a very, very atypical pattern of doing something, then it could be, again, some individuals at least may not want to do something like that. So it's a sort of additional layer of complexity, I think, that's important to recognize.
Yeah, I think that's a great point. Yeah, I got that. Yeah, it's almost, we always talk about this wonderful degeneracy and we can solve things in a million different ways. But you're right, there are these social norms of form, right,
Right.
beyond function,
Yeah.
right, that are kind of, yeah, you might be able to run walk like that, but you're going to get a lot of looks and
Right.
people teasing you if you're a kid, and so. You're right. I think we could conceptualize those as just a different type of task constraints, right?
Yeah.
Not just beyond with the normal ones we think of. They're kind of social constraints. Yeah, I think that's a really interesting issue. Yeah. Hard. Did you want to?
Yeah,
I
think in rehab, in general, this is where I kind of like the optimal theory, because it kind of really hones into the person and the person we're working with, making the task easier, for example, giving positive feedback. I mean, these things that we don't necessarily kind of take for granted or don't necessarily think about have a drastic effect. And I know it's fairly new, and we're concurrently conducting studies, but I'm curious to see that being applied to more of the atypical populations, and to see how that affects. I could imagine someone with Down syndrome, you give them a choice to do, like, that, I think to them that would be pretty fun, and it would kind of make rehab more fun and kind of evidently sort of impact their performance. And so I'm curious to see it being applied now to the more atypical populations. But that type of framework, I think, is important because, again, it may shift your priorities, like we've talked about, and I think that's important, at least for the clinician's end of things, to understand. So
yeah. No, I think that those are good points, and I think I think it's really important. And I think another point that I got out of a couple of the commentaries was, we can't take for granted kind of the time pressure. This is both on coaches and therapists, right? This idea of allowing people to adapt in any old way. It takes time versus the best I have is these patterns I know work for most people.
Right.
So I'm going to try teaching them to you in the really small amount of time I have with you. So I think we have to be careful sometimes to recognize the practical constraints on coaches and therapists, right? We push these theories, but if you want to get result looking good, and sometimes that's an important issue as well.
And I think the other point that I think it's in the Carr and Shepard commentary, which I think is an interesting point, is they sort of say, well, you can't really call this adaptive if it does not have the flexibility to adapt to different contexts or to real life, right? So it's yes, it's different, but it's not adaptive in any sense because, well, there's a sort of restriction in the movement repertoire to some extent. So it's not the same problem as the saying this was or works for typical individuals. This is just the same thing, but for atypical individuals, it's not really the same thing anymore. I think that's another point, because then that goes to this idea of why we need strength training or all these other things, because, well, you're also trying to expand the movement repertoire rather than just accept whatever comes as, well, this is the best for them.
Yeah, I agree. I got the same kind of a couple of the times. I don't know if I think they may have said this explicitly, that you get the idea of Bernstein's idea of freezing, degrees of freedom in this. So you're right on the technically that is solving the movement problem adaptively, but it's a really low level of adaptation, right? It's really inefficient, bare minimum solution you're coming up with, rather than coming up with some, really, I don't think the word, when we say adaptable, that comes to mind. The things. Yeah. Is there any other kind of main points that we missed, or anything that we, I don't think, I know they went into a little bit about kind of brain plasticity and reorganization. And if you read the article, they really get specific about some of the motor commands and all that. I think they do a good job of, they really bring a lot of different things together in this paper, from rehab, neuropsychology, motor control, so I think that should be commended. Yeah. Did you guys have any other things that we missed you can think of, or?
I thought, I mean, one other thing that
Yeah.
that stuck out is in the Goldberger Mayer commentary, they have this nice line I thought was they said, the goal of rehab is not to normalize, but to functionalize, which is sort of, I think, a nice way of seeing the responses. It's not really sort of creating the straw man of we're going to push the regular movement pattern on everybody, but we want to see what works in terms of achieving their function. And then the Kladsky article, I think, also sort of it goes back to that figure one you had, in the sense of, well, everybody's always reprioritizing. You think of a baseball pitcher, sort of tossing a stone or whatever. They're not going to throw it in their baseball pitching motion. They're just going to chuck it underhand. So everybody's really reprioritizing, whether you're thinking about it in the skilled athletes, whether it's development. Again, if a child can't walk very stably, well, then it adopts a wide stance and sort of waddles a bit. And so they say the real difference here is simply one of timescales, because you've had, say, a brain injury of some sort, or something big happening. Well, the reprioritization is just happening over a much longer time scale than what we typically see. So I thought it's fit very nicely with their figure one, is everybody's really reprioritizing, but just across different time scales.
Yeah, that really hit home with me too. And the limited work I've done, little bit of work I've done on injury. When I talk about it, one of the points I like is I don't like the word rehab and recovery, because they imply going back, right, to somewhere you were before. And the quote I always use is you can never step in the same river twice, right? Right. We're always adapting and adjusting. You can't ever go back. There's no back to where you were before. And so that's what that kind of rang for me. That figure really, I think, made that point. But I think the time scales one is another one, going back to what you said earlier about, sometimes that's where a coach has to step in a lot of times and prioritize the injury prevention, right? Because that's a long time scale thing that most athletes are not going to care about, especially if they're performing well. Yeah. So I think that's interesting. Oh, I think we lost RG, fell out here. The last thing, I mentioned, here he comes back. We lost you there for a second.
Yeah, man.
Did you have something you wanted to say about that, or you?
No, I think so. I think on the notion of timescales, they did mention something really interesting about structure versus function, and I think we hit on that as well. But there was one thing I wrote down. They said even with no redundancy in the control variables, there still may be redundancy in choosing time patterns for task variables, and I think that was really important, especially when it comes to understanding this paper in general. But yeah, I mean that's pretty, I think you guys hit the nail on the head with that.
Yeah. No, I think that's a good point. That's such a tricky thing to study. Things at multiple time scales, but you're right. It is so important. I guess the last thing I wanted to mention, I think if there was any, I think we hit on a lot of the commentaries. I don't know if there was any other one. My favorite, of course, is the one I mentioned a couple of times, Masters one, because he talks about sports. And I'll read a paragraph. In conclusion, we must agree with Latash and Anson's contention that in a typical population, the CNS should be left unfettered to play its role in defining motor patterns. We wish, however, to broaden the sweep of their argument to take it not only to populations with disorders, but also populations in which the required movement patterns are somehow atypical, e.g. sports. Like allow for variability and redundancy, which I think we all preach. So that I love that comment there. I guess the last thing I wanted to mention, I mentioned at the start this type of article. I saw you tweet about this a couple of days ago, Raji. What was your kind of thoughts on this this format of the target article?
It was like going through the article, sort of preparing a little bit for today, and it was so nice to have everything in one place, right? You've got because usually it's sort of like the typical way reviews work. You submit something, and then reviewers come back and say, hey, what about X? What about Y? And then the authors don't want to take that worldview because it's not their preferred worldview. And I think this sort of solves that problem, because that first target article, the authors are just free to express what they want in whatever framework they want. But then the commentators get to say, hey, you sort of didn't look at this or you didn't look at that, and it's all in one place, and then the authors get to respond, and and then we can sort of judge whether they did a good job or not. It's such a nice place to have. To me, this is what a review article should do, right? I mean, we always advise students to go read reviews, and this is exactly what you want. You want to know what the strengths are, what the weaknesses are, and that sort of then shapes your ideas on what experiments to do next or whatever. I thought it's just a brilliant format. I just can't. I still don't understand why it's not more popular.
Yeah, I agree. Did you want to jump in there with it?
As a student, I do agree. I would rather write and read these types of articles than have to write and read like really, really long, sort of not to the point, but like, these are just more like straightforward, right to the point. Like, you read it and get it done with. Like, it makes sense. Otherwise it's like you see yourself going all different directions, trying to figure out what this means, what that means, and like they may attempt to sort of make it clear, but it's just not there. And I think, in terms of writing a review paper, I think that I would always choose this type of format. Unfortunately, in the circumstances we live in, this type of format is not, the conventional format as of late. So
yeah, and to me, the other sort of feeling I have is like currently the only way you respond, let's say there's a big review article, but you say, well, they missed out on this X and this doesn't fit. You have to write like a letter to the editor, right? And I don't know, sometimes it feels confrontational almost. And this format completely removes that, because they know there are going to be commentaries at the end. So it sort of removes that stigma of, hey, I'm going to write to the editor.
Yeah, I agree. Yeah. So those don't know, when you do this, you write the article firsthand, you submit it, and then you usually list a bunch of names of people for the editors to ask for comments. Then they submit it, and then you can respond. So, yeah, and I like it because also we always hammer students for writing, lit reviews that they just summarize things and they don't integrate or challenge the area. But we don't hold ourselves to that standard too often, right? We have these reviews where there's not. Whereas if you write one of these, you have to kind of be like this. I think this is a great example because they push the line of way beyond what you normally write in scientific writing sometimes to deliberately be like that first figure we showed with Michael Jordan is deliberately meant to provoke and give people. So I really like that a lot.
And maybe even not like all reviews. I mean, some reviews I guess are necessarily historical, but like review papers which sort of bring together some new synthesis, something. I think those should always be in this format, because then everybody has a sense of, okay, this is where the thing is, this is where the deficiencies are. Let's go and test them. Seems like that would be the most efficient way to organize these papers.
Yeah, and I agree with you. You get these comments that either people wouldn't be willing to, because you don't want to be confrontational. Like the one I kept mentioning, Masters one. It's basically agreeing, and then adding a bunch of other examples and spins on it. You never write a letter to the editor where you agree with everything. Yeah. Right? It wouldn't get published probably. You don't just agree and say that's a great. So sometimes positive. We always want to be critical and negative when we review things, and sometimes there's not room for that positive. I think,
and it seems like even in this journal, right? I mean, there were a few. I know there was one like on Fitts Law and one on like the perceptual basis. I think there's a couple in like early 2000, and I don't know. I haven't seen any big motor ones after that, which sort of makes me sad because it's like weren't more people publishing in this journal, because it'd be really nice.
Yeah, I was saying before we went on the air, if you want another really good example, there's not motor ones. Is we were talking about Chaz Firestone's one on where he argues there's no top-down influences on perception, which is a really bold statement that really seemingly contradicts a lot of research. And that one got a lot of discussion going and things. I thought that was another great example. So it doesn't fit for everything. You want it to be somewhat not really novel twist. You're pushing something new, not just I believe in self-organization. I can write one like that, but I don't think that's really controversial anymore. Maybe the last thing I wanted, before we sign on, we have a couple more minutes. I asked you guys what's going on. Harji, we were talking before. You just finished the motor control summer school.
Yeah.
So for people that are anyone interested, I just wonder, can you tell us what's that about and your experience with that?
Yeah. So the Motor Control Summer School is pretty much by the International Society for Motor Control, and I've been going. I've been 2 times already. I went to Brazil, and then I went to the one in Pennsylvania, and it's run by Mark, Dr. Latash, and a few others. So yeah, Dr. Latash, Mindy Levin, Dr. Anatol Feldman, and Dr. Greg Schoner. So pretty big names in terms of motor control. And it's this year it's virtual, so it is free. So definitely check that out if you can. It's just a lecture series by all these people. And otherwise, typically you have to apply for it and make your way there. But it's a great way to not only network with really amazing sort of professionals and professors, but also as a student, I think just to get a better understanding of these different types of ideas that are being thrown out there. I mean, you have one-on-one time with these individuals. It's a little different. And so if you're interested in motor control at all, and the work of this that we just went over, I think it's a really special place to be. It takes about 3 days. I think 3 days of pretty much all day lectures, and then just hang out with people that come. People come from all over the world. So I think it's phenomenal, and I'm going to hopefully continue to go to it as long as I get accepted. So. Yeah,
that's great. Yeah, no, I've never done that. It sounds like
I went probably in 2009 or 8 or something like that. It was really great.
Yeah, I think it's really good. And they make the concept sort of clear, and as mentioned, just like these commentaries, you literally have people commentating right there, and they're arguing right there, and it's really nice to see that.
Right.
Just like professionals, sort of. I mean, not just like I'm sitting there watching it all, but you have Anatol Feldman, who really structured sort of equilibrium point, and then you have people sort of asking questions, challenging things, and it's really nice to see that dialogue, because as a student you're just like, okay, I see where they're coming from, but I also see where they're coming from, so I'm just going to sit here and listen because I have no idea so it's like it's really nice to see, and I think those are more so needed, right? I mean, we're talking about different conferences. Usually it's just like you have 15-minute presentation, you have 5 minutes of questions, see you later. It's like you can't, as a student, I think of myself, and I want to be challenged. I want to be told that I may be wrong and think about it in different ways. And I think there's got to be a change in how even that is. I mean, it was a bold statement, but even conferences nowadays, 15 minutes for 5 minutes of dialogue is not going to really cut it, right? As a student, I'll give a presentation for 5 minutes, but I want to talk and dialogue for 30 minutes with you, or 10 minutes, So it's like that, which is, I don't know. It's something that needs to be sort of looked into, I guess. But.
Yeah, I agree. I hope, I don't know what we can change well, who knows what conferences are going to look like. And Rajiv, I just want to, I know this is probably not the best time to ask this, but just kind of what you're working on lately, since we talked in the interview. I don't even remember what it was, but it was a while back. So anything new and exciting, probably not right at the moment, but before. Yeah,
sure. So one of the things I'm currently working on is this idea of relearning. So basically how you, it's not specific to the rehab context, but just this idea of if you've already got a movement pattern to do a task, and then now you're forced to choose an alternative, how well can you adapt to that new way of doing things? So that's something I'm looking at, both in terms of what factors influence how well you can transition, but also in sort of individual differences of, can you tell from baseline performance who might sort of adapt better than others? So that's one thing I'm working on. The other thing, we touched on a little bit, is this idea of this sort of standardization of tasks in learning, motor learning especially. Sort of getting this idea of, if everybody's doing their own thing, it's going to be really hard for us to collapse all those findings into any neat framework. So trying to figure out what we could do to sort of improve standardization of tasks, so we can say, hey, if you're working on X, then this might be a good task. Sort of similar to what, biologists and neuroscientists, they have model organisms, right? So you can't just study whatever you want. You say, oh, if I'm studying this particular mechanism, I study the worm, or I study a mouse. So sort of similar to that kind of concept.
Yeah. No, I think that's a great point, a great initiative. Motor control, the ones that we do have standardized are things like the key pressing tasks and really very simple ones. And there's something to be said for that. They can compare across so many different studies and stuff, but we do want to scale it up a bit to kind of multiple degree of freedom tasks and things like that. But we don't have the consistency there. Unfortunately, we all do radically different things. So, but yeah, so I think we'll sign off, guys. So thank you for everyone listening, and we'll end it there.
Thank you.
Great.